So we're here today at Providence St. Joseph Medical Center talking with Raymond Schaerf about our lung cancer program. Dr. Schaerf, can you tell me how many people in the United States may suffer from lung cancer?
Well, lung cancer, primarily related to cigarette smoking, but not always, is one of the largest killers of people, both male and female. And in fact, female lung cancers have risen in the last 5 years. So there's a lot. And what we have to do, very importantly, is not only know how to treat it, but how to diagnose it and how to stage it. Now, staging is important because it gives us the extensiveness of the disease and also maps out what our treatments are. What we do now compared to what we did only 5 years ago is a quantum leap in terms of improving that. So what we have set up over here, which is a multidisciplinary team, is a lung cancer screening program for heavy smokers. That is going to involve CT scans, which are not dangerous and which can help us. On the other hand, we do need to screen people just routinely, along with the guidelines that the AMA came out with, so that we can find out if they have a tumor or if they have something abnormal. After that, we put patients through an intensive protocol to try to find out, number one, if they do have a malignancy, and number two, if they do, what's the best treatment? The best treatment is not always to cut it out. The best treatment is not always to radiate it. The best treatment is not always to give it drugs. But what we found over here with a team approach, which is pretty extensive, involving pulmonary, internal medicine, oncology, both medical and radiation and surgery, is that we can optimize people's treatments as well as prolong their lives and in many cases cure them. We've also been very instrumental, and it's been more than 20 years now that we've done minimally invasive thoracic surgery here. So interestingly, when I started doing this in 1972, we had people that stayed in the hospital 2 weeks after surgery. Now they go home in a day or two. It's remarkable.
And can you tell me what unique experience or qualifications we might have at Providence St. Joseph Medical Center for treating patients with lung cancer?
I think the key that we have at this hospital is a multidisciplinary approach with experienced physicians as well as with newer physicians who bring some of the best and the brightest new stuff to our treatment plans. We have several conferences that we hold which are restricted to cancer. We have all the various specialties over there. We have people presenting cases to us for opinions, and we actually pretty much follow the NCCN guidelines. So we're a cancer center which aims to improve all the results as well as to improve the community.